packet the information about HICAP. Let me just quickly tell you what it is. HICAP stands for Health Insurance Counseling and Advocacy Program. You don't need to know that. Everybody knows HICAP. And we work very closely with a lot of these folks here. And I'd like to say a couple of things about some of the things that were mentioned and some exceptions. Sometimes there are exceptions. There's always yes, no, and maybe when it comes to Medicare. That's what we have to answer to a lot of the questions. The HICAP is the California State Health Insurance Program. There is one in every state and territory. It is funded by your tax dollars through the federal government to the states. The states then distribute it to nonprofits and other agencies that oversee the HICAP program. In Alameda County, we're under Legal Assistance for Seniors, and in other counties, it's under other organizations. And Legal Assistance for Seniors helps with a lot of the same things that, BALA. Sorry about that, do, but in a little bit different ways. Some of our services under the legal side are age-based. So you can always call us. There's some information in your handout about it. But HICAP helps anybody who has a question about Medicare. You don't have to be a Medicare person. You don't have to be Medicare eligible. You can be a family member. You can be imminent of Medicare. You could just want to know about Medicare. We will be able to help you answer those questions. And the way we do that is we have 32 now, I think. No, it went to 28 different locations around the counties. Every HICAP in California has different locations. You can call for an appointment someplace that's going to be convenient for you at a time that's convenient for you. There is no cost to the services because it's your tax dollars at work. So we also provide services at no cost. Medicare, Medigap policies, Medicare Advantage plans, prescription drug resources, recent health care changes, long-term care insurance. We have specialized counselors who deal with long-term care insurance, which includes information about the Medi-Cal benefit and other kinds of long-term care insurance, because as somebody mentioned, Medicare does not cover that. We'll help with insurance billing claims, by the way, as somebody mentioned. If you have Medicare and any other insurance and you get a bill, don't pay it right away. Please talk to somebody. Talk to the financial advisor, or talk to HICAP, or talk to Baylor, or somebody. Because so often it's a mistake or it's impatience on the part of the provider, especially for ambulance. They get really impatient. They love to bill you, even when you're not supposed to pay. So any kind of bill comes in, please question it. It may be correct, but you certainly don't want to pay something and then try to get your money back later, which can happen, but it takes a long time and a big fight. But it can happen. And then also, HICAP will help with helping you apply for some of those low-income programs that were mentioned earlier. Extra help for prescription drug coverage under Medicare's plans. The Quimby Slimby QI programs that help you pay for your Medicare costs. Remember, when you went, a lot of times before you get to Medicare, you think, oh, Medicare, I'll get Medicare, I'll be fine, no cost. Well, there are a lot of costs to Medicare. And if you're not aware, like these folks are, on how to help you get around those costs in a lot of different ways, then you can talk to HICAP or the financial advisor or any of these Medi-Cal, any of these other people. But that's partly what we do. Let me just quickly talk about ESRD and Medicare. Medicare, I just thought of something I forgot. I'll come back. Medicare coverage starts for ESRD diagnosed people 3 months after maintenance dialysis begins. So there's usually a month before that happens to get it set up. So it's like 3 or 4 months, kind of, depending on how you look at it. But it can also begin the first month or the second month if you agree to do training and at-home dialysis. It also can, Medicare can begin the month of admission to a hospital if a transplant is done within 2 following months. Now, remember Ken said how complex Medicare can be? So I'm going to tell you some of these complex things just so you'll know who to call. Okay? I mean, we can help you figure out maybe some of these things, and if we can't figure it out, we can also help with appeals, or we refer you to other people that can help with appeals, or get your questions answered. And if you call Medicare, by the way, and I'd be surprised if they didn't do this to you, but if you call Medicare, not Social Security, remember Medicare is not Social Security, it's different things. If you call Medicare, if you ask enough questions, they'll say, oh, why don't you call your local SHIP? In Alameda County, in California it's called HICAP. And they will refer you to us to at least go over some basics and maybe even help you with an appeal if that's the case. What else? Medicare coverage ends for ESRD patients 12 months after a patient no longer requires maintenance dialysis. That's the maintenance dialysis. Or 36 months after a successful transplant. That means there's no rejection after 36 months. Anytime a patient fails to pay premiums or decides to cancel. And as somebody mentioned, oh, I got this new plan, they told me it was going to be great for me, and you get into it and it's like, oh my word, what happened? So please don't be changing plans unless you really talk to someone who can help you figure out if it's going to be best for you. Medicare coverage will be reinstated if a patient resumes dialysis, or a patient gets a transplant within 12 months after stopping dialysis, or a patient gets another transplant 36 months after having the original one, more than 36 months. But there are also some gaps in, and by the way, correct me if you hear anything that's not right here, please jump right in. Because I certainly, it takes a village. We all work together closely here. So, if you hear anything, let me know. There are also some gaps in Medicare. Ambulances for routine dialysis, getting back and forth, is not covered. Except, remember I said yes, no, and maybe for Medicare? Except if transportation by any other means is deemed unsafe for the patient or the first responders. So what does that mean? It's rare, it's there. It usually have to educate some people in order to have that worked out. It sometimes takes an appeal. We can help with those kinds of things. Also does another gap is dialysis aids to assist in home dialysis. Now, it's interesting because nurse practitioners, doctors, some other professionals are covered for home dialysis, but aides are not covered. A little no, guess no and maybe? Inpatient hospital and skilled nursing, if the stay is only for maintenance, will not be covered by Medicare. Lodging with an outpatient facility is not near the home. We talked about that. Wage loss doesn't cover that. Another major gap is Medicare does pay for some required drugs, like heparin, EPO, some other drugs, but does not cover the cost of immunosuppressive drugs, except in some little clicky circumstances there. But Medicare assistance ends 3 years after a successful transplant. I already said that. Paying for transplant medications alleviates organ shortage by eliminating need to repeat transplants. So it would be very cost effective to Medicare to be paying for these things, but they're trying to get there. Another thing that Medicare covers, by the way, at no cost, at very little cost, is preventive benefits. And people should really be thinking about this because, as somebody mentioned earlier, the costs that Medicare is putting out for all kinds of care, including ESRD, can help be alleviated if you're taking care of yourself. So some of these preventive benefits, you should avail yourself. They're free or at very little cost. And they're very specific, and they're very specific billing and diagnosis codes that you have to help your doctor with. if you want to take advantage of those. You can call HiCap and we can help you with that. Now, we talked about the coordination of benefits with a active employer group health plan. So, let's see, what was not mentioned about that? I don't think anything, I think you guys pretty much covered all that. So let's talk about under 65. Under 65. Individuals who are entitled to Medicare benefits because of disability rather than age still have some of the same rights as people over 65 to purchase supplemental insurance. So ask if you're under 65 and you're just being diagnosed. When an ESRD patient who already has diagnosis and it has insurance turns 65, you may purchase a Medigap supplement. So if you couldn't have it before because you have a pre-existing condition or for other reasons, then once you turn 65, you're deemed no longer disabled, you're deemed aged. Their terms, not mine. And that gives you a special enrollment period to get better insurance if you would like to. Those are things you should explore. And by the way, if you have end-stage renal disease and you are in a Medicare HMO, if you're already in the Medicare HMO and you're diagnosed, they have to keep you. They cannot kick you out. They must cover your care. And they may try and tell you certain things that they'll cover and certain rules that they have about what they'll cover. But just know that your Medicare HMO is required by law to cover everything that Medicare would. So we can argue with them and help educate them to what they should be giving you, maybe if they say they don't want to. And I think you mentioned that. If they say they don't want to cover something, find out. Also, if you have a diagnosis of ESRD, you cannot get into a Medicare HMO after. So if you're in one, you can keep it. If it's before, you can't go in.
There are some maybes to that.
Yes, there's always maybes. Thank you. Thank you. So, did you want to quickly speak?
So quickly, Kaiser, if you have an employer group health plan or you're on a commercial plan and you never had a break in coverage, they will roll you over into their Kaiser Senior Advantage, which is a Medicare Advantage plan.
And that applies also to any other company that has a plan within that company.
Yeah.
Then not just Kaiser, but other companies as well. They are required to consider that, and sometimes with a little push. Thank you.
Yes.
Yeah. Let's see. Transfer to one plan or another. Yeah. Okay. An HMO may transfer from one plan to another, even if their plan closes. What you just said. This is another ongoing issue that Medicare is looking at to see whether or not this can change. It's just not. It's not good for the cost of health care. It's not good for the patients. It's not good for the companies. But that's the way the regulation stands now. Medi-Cal was just talked about. There are many low-income programs in the Medi-Cal system. One of the things that HiCap can do, if you think you might qualify for the low-income assistance for prescription drug coverage, we can help you apply for that. Just call us up. I do it on the phone. If you think you might qualify the Quimby or SlimB program, it helps pay Medicare Part B as in boy premium, then we can help you with that application as well. We can also help you see if you already got it. I'm going to go into a couple of things in this booklet. This booklet is over there. I got 5 minutes on the table. It's an excellent, excellent booklet from Medicare. And there was a couple of things in here I wanted to mention. And they were the waiting period, the 30-month coordination period will start even if you haven't signed up for Medicare if you are eligible for it. So if you put off Medicare, as in some cases you might, then that coordination period gets burned up until you do join. Another reason to think about joining Medicare when you're first eligible is for the prescription drug coverage, because that's going to change when you reach the end of your coordination period. And let me see, I think I marked some verbiage here. You don't have to take the Medicare A and B. However, later, you do need A or B to get prescription drug coverage, and you want to time things very closely, very specifically. You don't want to wait 30 months. You want to go maybe 28 months and start figuring out what you want to do so it's all set up. And if you're eligible for Medicare only because of kidney failure, your Medicare coverage will end 36 months after the month of transplant. Medicare won't pay for any services or items including transplanting drugs. That's if you have Medicare only due to ESRD. Usually people will have their disability in place by then, or they will have maybe 65, and then you can continue with the Medicare. Gee, there was one other thing about the drugs that I wanted to mention, and I don't have it in my head. Just know that you can call HICAP, and we can set you up with an appointment at no cost to get all of this kind of detail, and we have referrals. We have people we can refer you to for the things that we can't deal with. There is a great booklet over there on the table called Coordination of Benefits. Explains a lot about how that works. One of the things you must remember, if you already have Medicare and a prescription drug plan, Medicare is saying every single year you should reevaluate that prescription plan every single year. Sorry, folks. That's what this little card says. What we will do at HICAP, if you call us, we'll look at your drug list. We will do a comparison of at least 2 or 3 plans, and we will give it to you, and you can decide if it needs to be changed in accordance with your financial planner. Also, do yourself a big favor and go to mymedicare.gov, mymedicare.gov, and set yourself up an account for your Medicare, because Medicare is not sending statements out but maybe once a quarter now, and soon it's not going to be never, because they want you to do it all online. So if you have an account, your people who are going to be helping you can get in there with you and see what Medicare thinks is going on, which is not always what's really going on. I also have some booklets covering diabetic supplies and services, because Part B covers some, Part A covers some, and in between back and forth, and certain restrictions. So if you want to pick up some of those things on the table, that's it. Thank you.